Hi, everyone. I'm Dr. Roman, and I'm a practicing hematologist oncologist. And I'll tell you what, over the past 18 years, I've seen a pattern of mistakes that cancer patients typically make that are completely preventable and or avoidable. And believe me, when you've been diagnosed with cancer, you want to try to make sure that everything is done as perfect as possible because it is in your best interest. And in this video, I want to present to you the top 5 mistakes that I see cancer patients make so that it does not happen to you. Now, the first mistake that I typically see cancer patients make is being completely unprepared. I mean, let's face it, when you have been given a cancer diagnosis, this is a life-changing event. And when you go see your doctor, you have to have some sort of knowledge over the cancer that you have. I mean, you cannot show up to your doctor's appointment completely blind. I mean, you have to know something. You have to know the basics of your cancer. And believe it or not, this was the actual catalyst as to why I came up with my channel. Because in my channel, I have a bunch of cancer educational videos because I got tired of seeing patients come to see me completely unprepared. Believe it or not, when you've been given a cancer diagnosis and you go see your doctor, if you're prepared, you can have that important dialogue with your doctor where your doctor will throw a lot of information your way and you can question it. You can kind of participate in the decision-making process of your cancer because let's face it, we have a limited time with you, but you know yourself better than anybody. And when your doctor tells you, you know what, we're going to give you this chemo that can cause these side effects, maybe you have diabetes and maybe you've had a prior heart attack. And you know what, you can participate and say, well, doc, since I have heart disease, what about this other chemo that I read about that may not affect your heart or may not elevate your blood sugars? I mean, I'm just giving you examples where I have had patients come see me where they are prepared and we have this important conversation. And believe it or not, I was thinking about giving them treatment A. And after having this discussion with this patient, I decided, you know what? Come to think about it, then maybe treatment B will be the best treatment for your particular case, okay? Because every patient is unique. So rule number 1 is become familiar with your cancer, learn about your cancer so you can have that important conversation with your doctor. Now, mistake number 2 is second opinions. Now, don't get me wrong. I believe in second opinions. I think second opinions are good, but when it comes to cancer, time is important. And I can't tell you how many times I've had a patient seek a second opinion and then they come to me 2-3 months later ready to start treatment. And I ask them, where have you been? We've been calling you. No, it took me 2 or 3 months to get that second opinion, so I'm ready for treatment. And I tell them, well, you know what? This cancer has been growing for 2 to 3 more months. Because you know that when it comes to cancer, time is important. So, the mistake I don't want you to make is, yes, seek that second opinion. But if you're going to do so, get it within a timely manner because time is important. Because whatever benefit you can likely obtain from that possible second opinion will likely be lost by the sheer amount of time that has gone by. All right? So remember, second opinions are good, but do them quickly if you're going to get it. Number 3 is a patient being disorganized. Let me explain myself to you. I have had organized patients come see me where they bring a folder with all of their scans. For example, their ultrasounds, CAT scans, MRI scans, and they're everything organized, their laboratory studies. They bring their pathology result and they hand this to me. A lot of times they'll take it a step further. They will have a sheet of paper where they have their name, their date of birth, their past medical history. So everything they have, diabetes, high blood pressure, etc., their past surgical history, their allergies, a list of the medications they take. This is all on one sheet of paper and they hand it to me. Listen, you're spoon feeding me all of this information. And the more I know, the better off you will be. So do not make the mistake of being disorganized. Get yourself a folder. Ask for copies of your laboratory studies, your imaging tests, your doctor's notes, and put them in this folder. preferably the older information down at the bottom, and then as you obtain new information, you put it up top and you hand this to your doctor. Believe me, it makes a world of a difference, okay? Also, whenever you have a scan, especially a CAT scan, an MRI, or a PET scan, consider asking for a copy of the CD. So they will usually, sometimes they'll charge you $5, $10. Every place is different, but they will give you an actual copy of the imaging test. So some doctors, like your surgeons, for example, may want to actually look at the films, not just read a report. Very important organization. Now, error number or mistake number 4 is comparing yourself to other patients. I can't tell you how many times I've had patients tell me, "Doc, I do not want chemotherapy because my sister or my best friend had chemo and they did not do well." Listen, every cancer patient is different. I'll give you an example. You can have 3 patients with breast cancer and all 3 of them be completely different. That's right, you heard that right. All 3 of them with breast cancer, and each breast cancer is completely different. They will respond differently to treatment. I mean, a lot goes into this. And also, different patients tolerate chemotherapy differently. I'll give you an example. I have had cases where I have 2 patients of similar age, similar weight, similar organ function, and the exact same cancer receiving the exact same chemotherapy. And one will tell me, "Doc, I feel horrible. This chemo is killing me." And the other patient will tell me, "You know what, Doc? I feel great." To me, water is what you're giving me. And I know it's not water because, for example, my hair is falling out. It's just an example. But there you have 2 very similar patients that are tolerating treatment completely different. Also, there are many different types of chemotherapies. There are different chemotherapy combinations. There are different chemotherapy doses. So just because your cousin or your friend or your sister had chemotherapy or had any treatment for that matter, including radiation and surgery, it does not mean you are going to respond the same way. So do not make that mistake. And the last one is diet. Now, this is a controversial one, and a lot of times I get a lot of pushback. And what I mean by this is one of the biggest mistakes I see cancer patients make is that once they're diagnosed with cancer, they go on this very strict diet and they start losing a lot of weight. A lot of times they'll start fasting. And listen, when you've been diagnosed with cancer, we already know that because of the surgery, the chemotherapy, the radiation, the immunotherapy, the stress of cancer, the amount of protein that your body requires increases. The protein demands increase. This is not the best time, in my opinion, to be fasting. Now, don't take me wrong. If you want to do your fasting, if you want to reduce sugars, if you want to have a healthy diet, go for it. But consider doing it to prevent yourself from getting cancer or after your cancer treatments are completed. During just that one period of time during treatment, it's not the time to be very weakened because of a very strict diet. Now, I do recommend that you eat low in sugar. Okay, we all know that added sugars are bad for you, so obviously avoid them. Also, fat, avoid eating foods that are high in lipids. But I definitely want you strong. And I'll tell you what, I've seen patients that go on this strict diet, and because of that, I cannot give them the appropriate doses of immunotherapy or chemotherapy, or the radiation doctor cannot give them the complete doses of radiation therapy, or the surgeon will call me and he'll tell me, "You know what, this patient's too debilitated. I cannot perform surgery like this." And it might have been a surgery that could possibly cure you. So again, don't take me wrong. I'm not against fasting. I'm not against a very, very healthy diet. I'm actually for all these things. Just be careful when you do them, okay? We want you strong so that you can tolerate all these treatments. And that's it. Those are by far the top 5 preventable mistakes that I see cancer patients make. Now, shoot me a comment. I really want to know what you have to say, but I can tell you I have over 18 years of experience in treating cancer patients, and believe me, you do not want to make these mistakes. So consider checking out some of my other videos, and all the best to you.